morning, Dr. Anthony. Thank you for joining us for today's COVID-19 update. Dr. Anthony, yesterday at the Two Shells conference, you had a chance to interact with the various leaders, and you did take the opportunity to speak on the importance of vaccines in the pandemic. Could you say what was the response like, and are you optimistic that they will take the lead in ensuring the members of their communities are vaccinated against the deadly COVID-19 disease?
Well, I think we had a very good interaction with the two shows, and I'm convinced that they understand the importance of getting vaccinated. So I'm extremely hopeful that they would take this important message back to their communities and work more closely with the Ministry of Health staff in the various regions so that we can increase vaccination. Um, as I said to them, they can reach out to us anytime, and we are willing to provide the technical staff to go into the communities to do vaccination. But it has to be a collaborative effort between us and the community. And if we work in that way, we'll see higher uptake in many of these villages. The 5 to 11 vaccine, for example, that's an area that we need to work on. And of course, in those communities who initially take their primary doses, now we have to work on making sure that they get their booster shots. So I think if we work collaboratively, we would make a change in many of these communities.
Okay, for those who may not know or have an idea, what's the main challenge in getting these communities vaccinated?
Well, from a technical point of view, from our point of view, there is no challenge really because we would send in the technical teams to do the vaccination. What we have from the community side sometimes, there's a lot of hesitancy. And that's because of misinformation that is circulated in the community. So people have various apprehensions. We have a project that we've been working on to figure out what these apprehensions are, um, to figure out what are the false information that is circulating, and then to counter that with the right information. And hopefully, by giving them the right information, that people will be able to make decisions. We also found that in some communities there are persons of influence. In some areas, you have religious persons who are or religious leaders who are dissuading people from getting vaccinated. And that's very highly irresponsible because, in many instances, if these persons get sick, they can end up with a more severe form of the infection. And so, you know, instead of dissuading people, they should really, these persons should really become more acquainted with what the science is saying and then use their influence for a good purpose, and that is to encourage people to be vaccinated.
Okay, moving on. With the emerging new subvariants of the Omicron, how effective are these vaccines in protecting?
So, what the vaccine would do is to prime your immune system. And once your immune system is primed, if you get infected, your body would be able to respond faster, and therefore you would get less presentation of symptoms. You will get better faster. There are, however, a category of patients, those with underlying um, problems, underlying disease, those who are older, that can have a harder time if they're not vaccinated. So, in talking to these types of patients, what we need to do is to make sure that they understand the importance of getting vaccinated.
And a final question, how many cases have we recorded in the last 24 hours and what's our current active case count?
So we have had 94 cases in the last 24 hours, and currently we are monitoring 879 patients.
Okay, what about hospitalization?
We have 32 people in hospital, 4 in the ICU.
Okay, thank you, Dr. Anthony, and that concludes our COVID-19 update for today.